Leeds is already home for innovation, absolutely leading the way. We've funded a number of projects in their infancy to get them to the point where they have national or even international relevance to provide better treatment to patients. The new hospitals programme is a remarkable opportunity to provide the platform to take that to the next level.
There are only 3 centres in the country who provide liver surgery for children. Leeds is one of them. And because of that, we get referrals from all over the country. The benefit of robotic surgery for the patients is that there are many procedures that we would not have been able to perform using conventional keyhole surgery. But with the robot, we are able to do that. And the patients benefit from it. The pain is minimal. The trauma is minimal. There are patients who would have stayed in the hospital for a week, but with the help of the robot, when we perform surgery, they can sometimes go home the very next day. So even in very small children, we are able to do keyhole surgery without any difficulty using the robot.
So within Leeds, University of Leeds and Leeds Children's Hospital, we have some amazing researchers at all different stages of their career. One of the things we're doing in Coral with some of the Leeds Hospital Charity funding is we've developed fellowships to support the development of child health researchers across Leeds, kind of now and into the future, so that we make the most out of the really good quality sort of child health research talent that we have in Leeds, but we also have a sort of sustainable pipeline of researchers coming through. So the ultimate aim of Coral is to improve child health for the young people in Leeds. We think one of the ways that we can address some of these issues is by better working together across all the different departments in the University of Leeds, but also linking more collaboratively with Leeds Children's Hospital and the clinical teams that are working there. And then once all of that is together under one umbrella, then we can work more systematically with other areas of child health across Leeds.
The cystic fibrosis care in Leeds is actually recognised both nationally and internationally as a centre of excellence. We have a dedicated paediatric service and adult services with around 650 plus individuals we care for. So the Leeds Hospital Charity has funded a very important project, which is basically looking at the underlying defect in cystic fibrosis. Cystic fibrosis is an inherited condition. It is due to you inherit one gene from your mother and one from your father, so it's called autosomal recessive. And this little gene codes for a very important protein, which acts as a little pump in lots and lots of cells throughout the body. And unfortunately, in cystic fibrosis, this little pump is defective. With the support of Leeds Hospital Charity, we've been able to really try and investigate the underlying problem and some of the mechanisms associated with progression of disease.
The vision for the future is to train more people in robotic surgery, more surgeons, and also to offer this service to other subspecialties that we have not used so far. For example, we are going to start to use in cancer surgery. There are many cancers which we can remove using keyhole surgery, and robot will be greatly beneficial for that. Ideally, I would like, and I think it's beneficial, to have a robot center instead of just robot being in one theatre. The benefit of that is that if we have one robotic center, it can be accessed by a number of surgeons, number of people, and they can use it for teaching, training purposes, and obviously for clinical reasons.
What we believe in very strongly is evolution. You must change and evolve, get better all the time. And that really needs to be the ethos for the new paediatric unit. It needs to be a unit where there is technology, there's investment in research. We know that if you understand research and you link it into clinical care, which is what we believe in here, you get a much better outcome. You get better survival, patients understand what's going on, you get a much better quality of care.
Having the best environment to be cared for you can't underestimate the impact that will have. We want to make sure that it's absolutely state of the art now, so it can stand the test of time and still be a fabulous space for children to be cared for in the future.
I think the future is looking very bright. I think the majority of individuals with cystic fibrosis will live a relatively normal life. However, there is a cohort of individuals where we're still struggling to find treatments. And that is what we need to do. And I've always said to my patients, I'm here till I find that treatment for the last cohort. I really do believe that there is a real potential for a cure for all within the next 10 years.
Please get in touch about how your gift could make a real difference here in Leeds.